Look in the mirror. Go on, I'll wait. What's the first thing you see? Not your smile, not the color of your eyes, but them. Those shadows, those pouches, those little sacks of fatigue that tell the world a story you didn't necessarily agree to. You've tried the cucumber slices. You've spent a small fortune on creams with fancy French names. You've even tried to convince yourself it's a sign of wisdom. But every morning, they're still there. Your eye bags, your personal, permanent souvenirs from sleepless nights, endless stress, and maybe from your own genetics. What if I told you that almost everything you think you know about treating them is wrong? That you're fighting the wrong battle entirely? Today, we are going on a deep, and I mean deep, dive into the world of periorbital puffiness. That's the medical term for your eye bags. This isn't just a surface-level skincare video. This is a masterclass. We will dissect the anatomy of your face, travel through the layers of your skin, and uncover the real reasons they've taken up residence under your eyes. By the end of this, you will know exactly what type of eye bags you have, and more importantly, the exact strategy from a $5 drugstore buy to a $5,000 medical procedure to effectively treat them. This is the only video on eye bags you will ever need to watch. But first, we have to understand the enemy. Chapter 1, the 7 culprits. It's not just sleep. Let's get one thing straight right now. Blaming your eye bags solely on a bad night's sleep is like blaming a hurricane on a single raindrop. It's a factor, but it's not the whole story. The under eye area is the most delicate, thinnest skin on your entire body. It's the first to show signs of, well, everything. And there are 7 primary villains in this story. 1. The fluid brigade, puffy bags. When you sleep, gravity does its thing. Fluid, lymph, and blood can pool in the under eye area, creating temporary morning puffiness. Allergies are a huge amplifier here, causing histamine release and inflammation. 2. The fat hermits, protruding bags. Meet your orbital fat pads. They're like little cushions that protect your eyes. But with age, the membrane holding them in place, the orbital septum, weakens. The fat says, "I'm outta here," and herniates forward, creating that classic permanent bulge. 3. The collagen catastrophe, hollows and dark circles. This is a 2-part tragedy. Part 1. Your skin loses collagen and elastin. It becomes thinner, like a worn-out sweater. Part 2. The blood vessels underneath, which were once hidden, now become visible. And what color is blood seen through thin, bluish skin? Blue, purple, dark gray. That's your dark circle. 4. The genetic hand-me-down. Look at your parents. Go on, pull out a family photo. If they have prominent eye bags, you, my friend, have just won the genetic lottery, and it's a prize that often shows up shockingly early, sometimes even in your 20s. 5. The sun's betrayal. UV radiation is a frenemy. It breaks down collagen and elastin at an alarming rate, accelerating the thinning of your skin and making those blood vessels scream for help. 6. The lifestyle leak. Salt, alcohol, chronic screen strain, smoking, and sleeping on your face. Each one is like a little leak in a dam, contributing to fluid retention, poor circulation, and structural breakdown. 7. The allergy assassin. We touched on this, but it's so important it gets its own spot. Chronic allergies cause chronic inflammation. It's a constant low-grade war under your eyes that you might not even feel, but your face is showing the battle scars. Feeling overwhelmed? Don't be, because in the next chapter, we're going to play detective. I'm going to give you a simple, at-home test to determine if your bags are primarily fluid, fat, or hollows. This one test will save you years of wasted effort and money. Chapter 2. The At-Home Detective Kit. The Press Test. Gently press your finger on the puffy area. Hold for 30 seconds and release. If the puffiness disappears momentarily and then slowly returns, you're dealing with fluid. The pressure displaced the trapped liquid. This is good news. This is often the most treatable type without surgery. If the bulge remains firm and doesn't change much, you're likely dealing with fat. It's structural, not liquid. Now, look at the area next to the bulge towards the top of your cheek. Is it sunken? Does it create a dark shadow? If so, you have hollows, tear trough depression. This is a volume loss issue. Most people have a combination. But knowing your primary enemy is 90% of the battle. Now let's talk about fighting back, starting with what you can do before you even think about a doctor. The at-home arsenal. The cold compress, not cucumbers. They are the wrong shape and don't stay cold. Use a chilled spoon, a gel mask from the freezer, or even a bag of frozen peas. The cold constricts blood vessels and reduces fluid. Do this for 5 minutes every morning. The massage. Gua sha and jade rollers can work, but not for the reasons you think. It's not about toxins. It's about manual lymphatic drainage. I will show you the exact technique from the inner corner, along the under eye, out towards the temple, and down the side of the face. Always be gentle. Caffeine topicals. Do they work? Yes, but temporarily. Caffeine is a vasoconstrictor. It tightens the blood vessels, reducing the bluish hue. It's a great cosmetic fix, not a long-term cure. Look for it in serums. The long game skincare. For collagen and thinning skin, retinoids, the gold standard. Prescription tretinoin, or over-the-counter retinol. This is the single most proven ingredient to thicken the skin by stimulating collagen production. It's a marathon, not a sprint. It takes 6+ months. Warning, it can be irritating. Start slow. Vitamin C, a powerful antioxidant that protects against UV damage and also helps with collagen synthesis. Use it in the morning. Peptides. These are the building blocks of collagen and can signal your skin to produce more. Sunscreen, non-negotiable. SPF 30+, every single day, rain or shine. This is the most important step to prevent your situation from getting worse. The lifestyle overhaul. Sleep on your back. This uses gravity to your advantage, preventing fluid pooling. Pillow elevation. An extra pillow can help. The salt and alcohol cut back. This isn't just wellness fluff. It directly impacts fluid retention. The when creams aren't enough. Teaser. These strategies can create dramatic improvements. But for some of you, especially those with genetic fat pads or severe hollowing, you're hitting a ceiling. You're doing everything right, and that bulge is still there, staring back at you. That's when we enter the next realm. The realm of needles and lasers. And what I'm about to show you next is not for the faint of heart. Chapter 4. The Medical Miracle Zone. Welcome to the big leagues. This is where you invest significant money for significant and often permanent results. A crucial disclaimer: I am not a doctor. This is for educational purposes. You must consult with a board-certified dermatologist or plastic surgeon. Procedure 1. Fillers for hollows, the non-surgical fix. What it is: hyaluronic acid fillers like Restylane or Juvederm are injected into the tear trough to fill the hollow, lifting the shadow and smoothing the transition from cheek to eye. The good: immediate results, minimal downtime. The bad: temporary, lasts 1 to 2 years, expensive. Risk: if done by an inexperienced injector, it can look lumpy or create more puffiness. The under eye is the most technically challenging place to inject. Procedure 2. Lasers and energy devices for skin tightening. Fraxel, CO2, RF microneedling, Morpheus 8. These devices create controlled micro-injuries in the skin, forcing it to heal and produce massive amounts of new collagen. This can thicken the skin, reducing the appearance of dark circles and tightening some laxity. The good: addresses skin quality directly, long-lasting results. The bad: significant downtime, redness, swelling, multiple sessions, expensive. Procedure 3. The Holy Grail, lower blepharoplasty, the surgical fix. What it is: this is the definitive solution for fat pads. Step 1. Diagnose. Do the press test: fluid, fat, or hollows. Step 2. Maximize at home. Implement the cold compresses, the right skincare, retinol, vitamin C, sunscreen, and the lifestyle changes for 3 to 6 months. Be patient and consistent. Step 3. Evaluate. Are you happy with the results? If not, and if your main concern is structural. Step 4. Consult. Book consultations with 2 to 3 reputable, board-certified professionals. Discuss your specific anatomy and whether fillers, lasers, or a blepharoplasty are right for you. Your eye bags do not define you. They are a physiological condition, not a moral failing. You now have more knowledge than 99% of people about what they are and how to fight them. The power is in your hands. If this deep dive helped you, if it answered questions you had for years, then pay your knowledge tax. Smash that like button. It really helps the channel. Subscribe for more no BS deep dives into the science of beauty and health. And most importantly, share this video. Share it with your friend who's always complaining about her puffy eyes. Share it in your family group chat where everyone has the same genetic bags. Let's spread the truth, not the TikTok myths. Leave a comment below telling me what your aha moment was. Was it the press test? The difference between fluid and fat? I read every single one. Thank you for watching. Now go look in the mirror again, but this time, look with knowledge and with power.